I know Rachel covered this, but again, I think it's a good little review about how to respond to a disclosure. Number one, believe her. And again, you tell her you're sorry that happened to her, and that what happened to her was not her fault. Ask her if she's disclosed to anybody else. Make sure she's safe now. Don't ask why or how it happened, but do ask what happened. And again, the importance of appropriate screening and referrals. I think it's good to recognize too that your patient or client might be facing things that can be re-traumatizing, situations where she doesn't necessarily have choice or control or options, and she might be facing a crisis pregnancy, or a pregnancy that's threatening to her health, and just because of where she lives, she might not have access to pregnancy options counseling, or an abortion provider, or even a provider that will talk about abortion. So I'm hoping that today might spark some dialogue about things like that, that patients don't have any control over, and I think it is a recognized issue in the community. And again, explain, empower, and engage the patient. Give her as much informed choice and control as possible. Let the patient know that you're there for her and you're willing to help. And she can return or contact you at a later time if she needs to. And again, the follow-through is always important, because you're trying to build a trusting relationship. So you need to follow up with what you say you're going to do. Here's a quote that I like, and it's from a French-Canadian female Buddhist monk. Compassionate action involves working with ourselves as much as others. And what that means to me is that we have to recognize our own prejudices and work within them, and don't deny that they exist. Of course, we all come with our own prejudices and biases. We're human. Like I said, sometimes I want to run the other way, and of course I don't do that, but I recognize that within myself. Another example is that I had a nurse practitioner colleague. And she's a great, clinician, a super smart woman, and she was a master in martial arts. And if we ever had a patient that had a history of rape or sexual assault, she would never want to see these patients, because she felt like, how could she let that happen to herself? Women need to be able to defend themselves, and she felt like she would never let that happen to her. But in reality, we know that that's a false idea, because even big, strong men can be victims of sexual assault. But anyway, I talked to her about this attitude that she had, and it was kind of an emotional discussion it ended up being, because I was worried that, like, what if she's the only clinician here, and she does have to see, a patient that maybe was following up, like maybe didn't go to the YWCA for an acute exam, but maybe was following up now at Planned Parenthood because she had been assaulted in the past, and she was worried about what was going on. So I had to address this issue with her to make sure that she was able to give compassionate care to someone. We're not in our clients and our patients' shoes. Sometimes we don't even know what their shoes look like, but we've got to try and be non-judgmental, and we not everybody does what we want them to do, or what we think they should do, but we've got to move past those things. And lastly, it's important to care for the caregiver, or care for ourselves, because this kind of work is emotionally taxing. So we need to be able to take care of ourselves, whether that's like reading or doing yoga or getting out in the garden or loving on your pets or your kids or grandkids. Do it. Take care of yourselves, because we have to, we need to continue to soldier on. And here's some resources. The IAFN is the Association for Forensic Nurses. RAIN is always a good place to get some stats and helpful tips. And this is Planned Parenthood and the YW. And that's the number for the Nurse Examiner program. And there's always an answering machine on there during after hours, and they have the number to the crisis line too. So, any questions or concerns or anything that anybody wants to talk about or share? All right, I must have done a good job then.